Dr. Lisa Goins, nurse practitioner with Couture Healthcare, and the question is, how do I deal with people that want to come in and tell me their life story? A lot of providers have a very small time to see you. It depends on, that time depends on when you called in and you talked to the front desk, the scheduler, or the receptionist about what you wanted to come in for. Now, if you said, I'm not a new patient and I want to come in and talk about my heart or medicine refills, that means that you're probably going to be scheduled about 15 minutes. That's usually the standard time frame, which means that that still will include possibly getting all your vital signs, getting you back to the room, getting all your medicines down, and then talking with a provider. Okay? Different people time the appointments at different points. Some people time it as soon as you sign in. Some people time it by the time that you schedule the appointment. Sometimes the time starts as soon as you are brought back to do vital signs. And sometimes, depending on the provider, it may start as soon as you see them. Okay? So you have to understand that as far as how the office dynamics work. A lot of people are like, well, that person didn't spend a lot of time with me. In reality, that window of an appointment may have included all those other disciplines, so you need to be sure about that. So when you come in to the room and then you want to tell me your life story, I have down that you wanted to talk about refills or you wanted to talk about your heart or something. I was only allotted this much time, which makes it hard for you and hard for me to get everything down. Now, often some providers will listen and then chart later. Sometimes it's not possible. Providers have to chart while they're listening to you. So unfortunately, we don't get to make as much eye contact as we would really like. So some of us will sit this way, some of us will sit this way with the light, and we'll have to look up and down. You know, it's just the nature of the beast, and we apologize in advance for that. But please don't start off with, oh, you know, this one did this and this one's that and all this and all that, and you know, your time is ticking down, so it's very important to get those questions out. Oh, by the way, so we need to start with one or two things. Now, if you have a whole laundry list of problems, that's fine. Make sure that you tell the scheduler, I need to see the provider or Dr. Lisa for a time frame. I need to discuss this, this, and this. Things are all going to hell in a handbasket, and I have a lot to discuss. I can schedule you for a lot of time. I can schedule you for 30 minutes, 45 minutes, 60 minutes, depending on how long it is. I may need to come to your house and talk to you for a house call visit. Some of the providers do that. So there's a lot of options there. So you definitely need to kind of stay focused. Now, I love to know everything about my patients, but unfortunately I don't have a lot of social time because it is an appointment. Just like when you make a reservation for a table in a restaurant, that table is yours for this particular point of time. If you show up at 8 o'clock, you get that table. If you're not there by a certain time, you lose your table. They will take another reservation or a walk-in over you. So make sure that when you do come in, you come in slightly early, make sure you have any paperwork filled out, and let the person who's scheduling you know. Now, if you come in and the provider says, I can only address 2 or 3 very important things today, like getting your refills, we got to get you some lab work, and you had some other questions, let's reschedule you to come back in a week or 2, and let's address these things. And they will make a note of it, and they will schedule you that time. You can always come back in, and they can always answer all those questions until you are happy. So that is possible. Again, my name is Dr. Lisa Goins, nurse practitioner, and I'm with Couture Healthcare. And the question was, how do I keep my questions and down to a minimum, and how does a provider deal with a chatty patient? Again, thank you very much. And if you like this video, like, subscribe, and share. Couture Healthcare is the YouTube channel that you're looking for more of our videos. Thank you very much.